Good morning, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm thrilled to welcome you to Session 2 of the 2021 Regional Health and Hunger Summit Series. This is a virtual series as part of a larger project where we will take a candid look at connections between the healthcare system and community resources that address hunger. For this series, we're looking at 3 counties in our state, Boone, Lincoln, and Logan. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website, thinkkidswv.org, and on Think Kids Facebook page. And we hope you'll join the discussion because now more than ever in this moment, we need to unite in our efforts to ensure all West Virginians are as healthy as they can be with access to healthcare and nutritious food. There are a lot of challenges to this, and I've met some great people in these counties who are leading efforts to build these bridges. And so we're glad you're here with us to meet them and join the conversation. Let's get started. Now, we know that a lot more West Virginians than usual are on the internet. And so if you get disconnected or have difficulties hearing, please know that this is being recorded and will be shared on our social media sites tomorrow. Also, you'll have the opportunity to share your thoughts and ask questions at the end of the panel discussion. Go ahead and type them into the Q&A box while they're fresh in your mind if you'd like, and we'll get to them at the end. And with that, let's get underway by thanking our sponsors for the event series, the Palatine Foundation of Huntington, for their generous financial support, and to our community sponsors, including Pride Community Services, the Salvation Army, and Unicare Health Plan of West Virginia. Here's our agenda for today's session. We'll begin with a brief look at some statistical health data about the geographic regions that are part of the Summit series. And then we'll turn the video over to our 3 presenters. And then we'll circle back to questions from both you, if you have them, and a few pre-prepared questions as well. With that, let's take a look at a regional map of designated medically underserved areas and populations, with circles, squares, and crosses designating federally qualified health centers, FQHC lookalikes, and a cross representing the 1 hospital in the 3-county area. And you can see if you look a little closely, it's the regional area, but you can see the lines designated Lincoln, Logan, and Boone. Medically underserved areas and populations are areas or populations designated by the Health Resources Services Administration as having too few primary care providers, high infant mortality, high poverty, or a high elderly population. You see most of the areas designated as medically underserved. Boone County is blue because it has medically underserved populations, meaning that it has a subset of the general population that is medically underserved. Much of West Virginia, especially southern West Virginia, has designated medically underserved areas. Here we go. The next slide is 2010 to 2015 data from the Centers for Disease Control and Prevention comparing life expectancy at birth. As you can see, there are surprising swaths of area in southern Appalachia, including Kentucky, where life expectancy doesn't exceed 75 years of life. In some pockets with larger areas in Logan, life expectancy is up to 81 to 82 years of life. Again, taking a more regional look, this time at 2018 data from Medicare on beneficiaries diagnosed with diabetes. You see a rather high prevalence rate in southern Appalachia, with our 3-county focus being no exception. Medicare is a federal program that provides health coverage if you are 65 years and older and or under 65 and have a disability, no matter your income. Nearly 20% of West Virginians are aged 65 and older, and we have the 3rd highest older population in the country. Looking again at the same population who have been diagnosed with high blood pressure, again, the darker color of purple, the higher the prevalence. Being overweight or obese increases your risk of developing high blood pressure. In fact, your blood pressure rises as your body weight increases. High blood pressure is twice as likely to strike a person with diabetes than a person without diabetes. And so we see a close connection between nutrition and health, and we see that in this 3-county area experiences higher rates of these chronic conditions. Finally, on our last map, all these maps, by the way, are available for free on a website called Policymap. We see from US Census data estimated percentages of individuals in these counties who have health insurance. And we see that rates fluctuate even within the same counties. And I think this is in line with something that Mike Tierney said last week, that there are pockets of poverty in these counties. Just a few miles down the road, you can see a difference in poverty rates and accessibility to services. And so now that we have a little context around the health of residents of Boone, Lincoln, and Logan counties, let's begin the conversation by introducing our first panelist. Dr. Anitra Ellis is a 2016 graduate of West Virginia University's Family Nurse Practitioner program. She is a board certified by the American Academy of Nurse Practitioners. Dr. Ellis joined Coalfield Health Center in 2019. She is currently an assistant professor of nursing at Southern West Virginia Community and Technical College. Thank you for joining us today, Dr. Ellis.
Thank you so much for that introduction, and thank you for having me today. So as you mentioned, I am a family nurse practitioner at Coalfield Health Center, and also I work as the community health educator for Wild, Wonderful, and Healthy Logan County. So if you don't care to go to the next slide, please. Wild, Wonderful, and Healthy Logan County is a collaborative between several healthcare entities in Logan County. We have Coalfield Health Center, we have Pride, Logan Regional Medical Center. We also have, under the direction of the Center for Rural Health Development, and then we also collaborate with both Marshall and the West Virginia School of Osteopathic Medicine. And really, we actually serve the communities of Logan, Boone, Lincoln, and even Mingo County. So what Wild, Wonderful, and Healthy Logan County does is actually just looking at different health behaviors, and we are trying to address these over a long term so that we see better health outcomes for our future. Next slide, please. So we see here some different health behaviors that are laid out based on Logan County, West Virginia, and the United States. Unfortunately, our state is at the bottom of the nation in health statistics, but we notice that Logan is a lot of times at the bottom of the 55 counties in West Virginia. We have specifically here, we see that our food insecurities, that we are at 16%, which is above both the national and the rate for the West Virginia level, and also some other unhealthy behaviors such as adult smoking, adult obesity, adult physical inactivity, excessive drinking, and insufficient sleep. So as she mentioned before, we know that these health behaviors directly tie to health outcomes and to our overall physical and mental well-being. Next slide, please. We see directly with diabetes in the United States, the rate is 9%, and West Virginia is 13%. And in Logan County, it's actually at an alarming 18%. We know with diabetes, you have the risk of obesity, you have the risk of high blood pressure, of stroke, and other heart diseases. So in Logan County, we have 9% of adults who have coronary artery or coronary heart disease or chest pain, whereas in the state of West Virginia, it is only at 8%, and in the United States is at 4%. Next slide, please. So food insecurity is not something that is new to our region, but it's definitely something that has been exacerbated through the COVID-19 pandemic. And with Wild, Wonderful, and Healthy Logan County, some things that we have done is we have collaborated with a local food pantry, which is what you see here is a picture of our executive director, Kristen Dahl, and myself. We actually worked the food pantry one day. That was through the Hungry Lambs Food Initiative. And we saw through that encounter 300 different families that were served that day. So it's complicated because a lot of people around here don't have access to healthy food. And then with COVID, we have people who are actually afraid to leave their homes and get and actually take advantage of the resources that are available. So through this, we saw that, there was more that has to be done, more people that need to be reached. So what we've done is we've actually started partnering with the Fresh Start program that is in Logan. And the Fresh Start program is a program for those who have had a history of substance abuse. And what they do is they have a local garden they have in which they grow different plants, or they grow different foods, in which that is donated to the local food pantry. So what we've been able to do as Wild, Wonderful, and Healthy Logan County is we've been able to partner with them and with Pride so that we can help to get materials for a greenhouse for them, and to help get materials for a mobile food market, so that the resources that we have available that they're producing, we can get those to the residents of Logan County and the surrounding areas, because they also go to the different counties. But the Fresh Start program is going to be essential. This is all people who, like I said, have had issues with substance abuse, who volunteer their time to come and make these gardens and the food pantry successful. So one thing that we did notice at the food pantry when we worked that day was that, there was a lot of healthy choices available. And the participants actually took advantage of that, and they took the food. So I think the biggest thing is just having food that is healthy, that is available for the participants to be able to take it. And with our culture in Southern West Virginia, we have the misconception that larger people are classified as being healthy, when that's not really the case. So we have a great opportunity with this program to not only provide food, but to educate on healthy lifestyle changes and healthy eating habits. Next slide, please. Some of the other projects that we have going on are the greenhouse project. Like I said, we are going to help the Fresh Start program to get their own greenhouse so that they can produce more produce. We have a water bottle project, which we are implementing in the schools right now, which is just encouraging kids to choose water over sugary beverages, which we know that's going to help long term with our obesity rates. We're also doing anti-vape programs in schools, just so that kids understand the dangers of vaping and nicotine addiction. And then also green spaces, as we noticed in that first slide with the health statistics. We have a population that is generally unhealthy. Next slide, please. So our services at Coalfield Health Center and through Wild, Wonderful, and Healthy Logan County have not been affected too much through COVID, but we have been able to expand and do telemedicine. So that's helped us to stay in contact with our patient, especially our patient population, especially those who are afraid to, come out due to exposure to COVID. One question I want to specifically address here is, in my experience, how would you describe food insecurity in the communities where you work, and what needs are being met versus needs that aren't being met? We've noticed also through different organizations that we've been involved in that food insecurities are large just because people don't have access to food. But, people are going to eat the food that they have. So, food insecurities are very, very real in Logan, Boone, and Lincoln counties. And it's not just having nutritious food, it's just having food, period. We've seen with the local schools that are providing meals. They've had kids as young as 6 to 8 year old that are calling and asking, when the food is going to be delivered for them and their siblings, just because they don't have any resources um, to feed themselves. And so that's been one positive thing that's come out of this, is that, they've been able to provide those kids with food throughout the summer and throughout the school year, even when it's been virtual, so that they have those healthy choices to choose from. I think the challenges that we have in our community as far as assessing nutritious food, number one is going to be cost. We know that it is much easier as far as cost to buy things that are already prepared, whether it be fast food or other unhealthy food choices that may have a lot of preservatives and things like that. And a lot of people just don't have the education as far as preparing the foods and spending their money the best, the way that they can make meals that are healthy, that will last their family, for a couple meals throughout the week. So we definitely struggle with preparation of food in our communities, and just being able to make healthy choices as far as food and beverages. So I think a lot of these other questions I've addressed in the presentation here. So that's all I have for now, and I'll be glad to answer any questions at the end that anyone may have.
Wonderful. Thank you, Dr. Ellis. And we're going to have folks from Hungry Lamb's Food Initiative on next week. So I'm really eager to learn what it is that they're doing there that's been such a success.
Yeah, I didn't want to go too deep because I know you guys are going to have them on, and they're great at describing what they do. So
yeah, really looking forward to it. So thanks again, Dr. Ellis. And our next panelist is Mark Linville, Chief Marketing and Communications Officer at Boone Memorial Hospital. Mark has been employed at Boone Memorial Hospital since June 1981. His first assignment was as a storekeeper. In 1984, he became the Director of Purchasing and held that position until 1996, when he was promoted to Executive Director of General Services. Mark holds an Associate in Arts and Administrative Sciences from Glenville State College and a Bachelor of Arts degree from West Virginia State College. He also has a Master's of Science in Health Administration. He is a member of the West Virginia Hospital Association and the West Virginia Health Services and Partners in Health program. He's also a member and past president of the Madison Rotary Club, a Scoutmaster for Troop 289 in Madison, and serves as a youth Sunday school teacher and various boards at the Madison Baptist Church. Mark, the floor is yours.
Okay, thank you, Kelly, and I appreciate that that introduction a little bit. So if we go to the next slide, please. Okay, next slide. I want to tell you a little bit about Boone Memorial Hospital. Like Kelly said, I've been here since June of 1981, and if you could, I'll let you do the math of what's coming up here in just a few weeks. Boone Memorial Hospital is a small rural hospital. We're a critical access hospital located in Madison and in Boone County, obviously. And we have this hospital that you see here was completed and built. We moved in June of 2016. So we've been in this facility almost 5 years now. This little hospital actually has a very comprehensive healthcare systems. We have 25 inpatient beds, and we're limited to 25 due to the critical access designation. We do have a 24-hour emergency department. We are a level 4 trauma center, and we also have telestroke capabilities in our ER. Our laboratory services are accredited by the College of American Pathology, and our radiology department also is accredited by the American College of Radiology. And we do offer a full gambit of radiology services such as CT and MR, DEXA scan for those bone density studies, ultrasounds, PT, cardiac rehab, respiratory, and other services. We are happy to provide specialty services such as cardiology, dermatology, psychiatry, ear, nose, and throat. And our most recent addition is our pulmonologist. The hospital is accredited by the Joint Commission. We just recently had our survey and came out with no major deficiencies in our survey. So we're very happy to report on that. Next slide, please. I would like to talk about some of the food insecurities in our community. You know, we do have some resources available. Actually, the church where I attend, we do have a food pantry, and I visited the food pantry yesterday to kind of get an idea of how things are going in our community. So the food pantry that we provide is funded largely by private donations, but we also receive money from the United Way, also the Boone County Community Foundation. So our food pantry is very well supplied. It actually does very well financially, and it's heavily supported. This usually serves portions of Boone County. There has been known times from people from Lincoln County come, also maybe some in Logan County, but primarily this food pantry serves the needs of people right here in this geographic area. What we're seeing here lately is a little bit of decline on the demand of our local food pantry. And we think this is for a number of reasons. We think that stimulus checks that are coming out from the government may play a role in people are not as financially challenged as they were in the past. But also there is an area soup kitchen. They used to serve free meals, and due to some issues lately, they do charge a small fee. There is a local discount grocery store for those who may need to stretch their dietary budget. We have one of those Save-A-Lots, which I think you go in and shop and bag your own groceries and those types of things. So that does help the food go a little bit further. And also Boone County has a Meals on Wheels program for our seniors, and that's a very needed service here in our area. Slide. Now, some of the food insecurities in our community that are not met. We don't have an established community food bank. We have had assistance from the Mountaineer Food Bank out of Gasaway. They have come down and served our community in the past with food distribution, and it's very much appreciated when they do that. But you know, this is not an ongoing situation. So a lot of times the food insecurities we have to meet here locally. And some of the issues can be that is transportation. Not everyone has transportation to get to a food pantry or a food source. Boone County is very geographically challenged. We have basically two areas we call the Little Coal area and the Big Coal area, usually separated by a mountainous region. And so transportation sometimes can be a challenge. Other insecurities is access. You know, a lot of times, like our food pantry operates in morning hours. There's not a public transportation system to get them to and fro. So obviously, sometimes access to these food pantries can be challenging. So these are some of the food insecurities that are not being met. And we've had all these issues for several years here in our county. Our economy is declining, our population is declining, and food insecurities are on the rise because of these issues. And if that wasn't enough, then slide. COVID-19 hit, and I'm sure some of you may be chuckling at the picture here. This is actually one of our physicians. This is a full PPE that he was about to go into a COVID patient's room. So he's prepared to go in. We were, like Dr. Ellis said, we were not largely affected by our services here at the hospital. We did maintain most of our services. We did obviously limit our visitation and people into the hospital. But there were some key things that were canceled. We have a healthy lifestyles program that our education department puts on here. They do discuss nutrition, food access, and things of that nature. So that public forum was canceled, and it has not has not started back since we've closed it back last year. So we hope that once the pandemic has died down a little bit, we hope to get that healthy lifestyles and healthy initiatives back up and going. Another area that we had to close was our exercise room. We do have an exercise room that we open to some organizations to let them come in and exercise. We obviously had to reduce that. So obviously a decline in exercise could lead to poor nutrition and obesity and other things. Some of the things that we actually had to do in order to meet the pandemic was we turned our exercise room, when we closed it down, we turned it into a COVID waiting room. So if someone presented to the hospital and had symptoms of COVID or had been tested and knew they were positive for COVID-19, they were directed to that waiting room, and that's where they were held until such time to see the provider. And then to go a step further, we took 2 of our exam rooms in our emergency department and actually installed doors into a hallway adjacent to this waiting room. So when the COVID patients were to be seen, we didn't have to bring them through the public area. We actually brought them through a private door and therefore reduced the amount of exposure in our facility. And like Dr. Ellis said, another thing that we did ramp up our telemedicine program. So we do have a telemedicine program, not only for our primary physicians, but we also increased our telemedicine for our specialty providers. Next slide. You know, I gained a lot of my information from the U.S. News and World Report, and you know, you'll see these statistics, and they look just pretty much like that you would see in Logan and Lincoln County. As you can see, as part of our food insecurities, we have a very high obesity rate. Again, diabetes rate, I think that Logan was like 18. You'll see we're right kind of targeted in that area of 17.1% on the diabetes. Now, the U.S. News and World Report did not show any food availability. I think this is due to the fact that we may not have an established food bank in this area or established nonprofit that's just solely designated for food distribution. Another item that seems to, I guess, hinder us in proper nutrition and healthy is our Medicaid population. We have a 34% population that's dependent on Medicaid services, and with this are the food vouchers that go along with this. You know, sometimes we're not sure on a Medicaid population if they are getting their annual well visits. This could prevent from having a healthier lifestyle. This could lead to poor nutrition and obviously health issues if you don't get the proper health care that you need. Slide. Like many others, we have our challenges in accessing nutritious food. Many of our population, they depend on the public schools to feed their children. You know, we know that a lot of times that when school is out, students have a hard time accessing food, and we're going to talk a little bit more about that here in just a few minutes. But we do depend on the schools. So obviously, you know, during the COVID pandemic, there's been a lot of schools that were closed down that went to virtual learning, and that presented a challenge to some of these people having healthy food. Also, unfortunately, in our area, we have a very high substance use disorder population, and it's sad to realize that many times that people are taking their resources and trying to purchase illicit drugs and other things, and probably not using that money to feed their families properly. So this obviously is an issue that we're having in this area. Also, a rural area food supply. As I mentioned earlier, transportation is an issue. When you go up Route 85 past the hospital here, there's not very many. There's a couple of grocery stores, but there's not a food distribution system that I'm aware of. And there may be. And if any of you on here know of something that direction, please send that information to Kelly and she can pass that along to me. We would love to know if there is any food resources up in that area. But the stores that are in these located in these rural areas, a lot of times they're what we call the mom and pop stores. Sometimes they have higher prices than your average food chain grocery stores. So this obviously does not allow people to stretch their food budgets very far. And also, U.S. News and World Report showed that only 11.4% of the food expenditures in our region are spent on fruits and vegetables. So obviously, if they're not spending on nutritious food, this can be a hindrance to actually getting proper nutrition. And one thing that was alarming in this report, it basically shows that 5.2% of our population does not have access to safe drinking water. Many of our rural areas depend on well water. There is city water in a lot of the incorporated towns in our area, but there's many areas within our county that depend on well water. A lot of these areas are around mining industries. Now, I'm not saying that that contributes to the problem. I'm just simply saying that the report shows that 5.2% of our population does not have access to safe drinking water. Another thing that makes us a little more unhealthy is our dependency on soda drinks and sugary drinks. And this seems to be very prevalent that more people are turning to these types of drinks if they don't have the safe drinking water. Slide. So what's Boone Memorial done to help address some of these food insecurities? Each year that we hold an annual health fair, and when we do our health fair, we ask participants to bring a canned food or a non-perishable item to donate to our local food pantries. While this may seem somewhat insignificant, we have over 500 participants in our health fair. We usually have at least a pickup truck load of food that is taken to the area food pantries. Also, during our food or our health fair, we have booths on nutrition. As you can see, this is actually a photo of our few of our dietary employees. We teach healthy cooking, and not only do they teach the healthy cooking, they also serve these meals. So we want to educate the population that you can cook healthy, you can eat nutritious, you can do it on a budget. So this is one thing that we are doing to help out some of the food insecurities. Slide. We mentioned a minute ago that we do some other things here in the county. We do assist and donate our time to what we call the Backpack Buddies, which is sponsored by the United Way of Southern West Virginia. This is basically food that is donated. We put it in our civic center here and basically create a assembly line to fill these boxes. And these boxes are stored away. And what happens is during those summer months, when we talked about the school systems that are dependent on meals to feed their children, we send out food boxes to these children 3 times per summer to help with the food insecurities. We also put literature in the box to give additional information where resources may be located to acquire food. Another little item that we help out is our local chapter of Veterans of Foreign War. They do an annual food basket drive around Thanksgiving and Christmas. We help contribute to that and give our time and our resources to further that program. And one other thing that we do is we have what's called pharmacy. And if you'll notice here, it's pharmacy, F-A-R-M, pharmacy. And this is a program that is sponsored through the WVU extension agents. And we take some of the local growers here that grow their produce. And you can see this box here has some healthy vegetables in it. And a doctor can, or a provider can actually write a prescription and say, you know, that they need healthy food, and they can go by and pick up one of these boxes. We did this actually a year before last, and it was very successful. We hope to reestablish that this year. Slide. So what are some of the things that we need to do to improve the collaboration between our organizations? As I mentioned, we don't have an established food bank here, and it would be nice if you were in last week's educational session. You'll notice that Mountaineer Food Bank serves a great portion of West Virginia. There's another food bank located in the western region, but Boone County was kind of sandwiched there in the middle, and we don't have an established food bank. So one of the things we need is we need someone to act as a lead agency, that they can coordinate all the efforts that we have here. We have some resources, but we don't have anyone that's really working as a lead agency to collaborate all these together. So if we had someone that could establish a lead agency that we can network with our local food pantries, to work with the Backpack Buddies, the VFW, the Mountaineer Food Bank, other people who help with food distribution, we think that this would be a great asset to our area. One thing we need to do is also to basically pull these our strengths together and our resources. And if we can do that, we can help feed our community and make a difference in food insecurities in our region. Thank you for your time. If you have any questions, put those in the Q&A box. I'll be happy to answer those after our presentations. Thank you very much.
Thank you, Mark. That was great, and we're going to get on that. We're going to help Boone County get a dedicated lead agency. I think that if we could do just that, it would be a real success for the series. So we appreciate your time, and I'd like to introduce our last panelist. Last but not least is Courtney Reynolds. She is a physician assistant and chief operations officer with Southern West Virginia Health System. Courtney graduated from Mountain State University with a Bachelor of Science from Marshall University's Physician Assistant Program, and with a master's in business administration. She is a CPR instructor and a certified medical examiner for the Department of Transportation Physicals. She has been with Lincoln Primary Care for 9.5 years as a family practice physician assistant and clinical director. Thank you for joining us today, Courtney.
Thank you. One of the good things about going last is a lot of the topics have already been discussed. One of the bad things about going last is all of the topics have already been discussed. As you know, our communities are very similar in the difficulties we have with food insecurities in the communities and what we have to offer. We are at Lincoln Primary Care Center and Southern West Virginia Health System. We do cover Lincoln, Logan, Mingo, and Boone counties are our predominant service areas, with some of our population on the outlying counties in Cabell and Kanawha as well. And today I'm going to focus on our Lincoln County projects that we have had. We do have in Lincoln County, we have noticed that there are food insecurities with our patients and difficulties in getting food. We don't have very many options for grocery stores without travel. One of our larger grocery stores closed within the last couple of years. And so now we have some smaller shops for people to be able to purchase these fresh fruits, fresh vegetables. Sometimes there are farmers markets that come out. At Lincoln Primary Care Center, we've tried to host these periodically throughout the growing season. But that is also been difficult at times due to what product is available. At Lincoln Primary Care Center, we've had a couple of different programs that we have partnered with. One of the programs that we are very proud of is our senior lunch program. We have had this program for many years, and what it is allow our population to come in and have lunch. It is free to them. They are able to make a donation if they choose, but if they're not able to make a donation, they can have a lunch. We try to make them as well balanced as possible and healthy for these populations. A lot of times it may be the only hot meal that our senior population gets. We have a workout facility that a lot of this population, they'll work out in our facility that we have, and then they'll have lunch together. And not only is it the meals and the exercise that they're getting, but it's the socialization that they're getting, because a lot of our senior population misses this socialization. Unfortunately, with COVID, we have had to stop the meals eating inside. We still do have a pickup for these meals to be able to allow this meal for our senior citizens and for our senior population, but they're still missing that socialization. And we're hoping in the near future, when things are a little bit safer with COVID, to be able to open that back up for the in-house dining. We also have participated in a FIT program. And what that is families getting fit together. It is for our children, or typically it is for the grade school age children. It's a week-long event. It's kind of a camp that we have, and we have our nursing staff and provider staff that partners with the local WVU Extension and teaches healthy activities that you don't necessarily need a lot of equipment for, activities that you can do around your house. And then also teaches about healthy diets, how to make a healthy snack, how to continue to learn about foods. And then we do bring the parents in on some of the education as well, to teach them about balanced food and things that the kids can take home and activities that they can take home. It goes beyond food and exercise, but as well as sun safety and swimming safety, those types of things that we try to teach at a young age to develop these healthy habits. We, like Boone, have participated in the pharmacy program in our community. Last year was our first year that we did participate in this program, and we felt that it was a huge success. We were able to, we noticed that the patients were very little apprehensive when we first contacted them about participating in the pharmacy program, and then tried to explain what it was. It connects the patients with the fresh fruits and vegetables, as Mark had said. And what we did is we looked at our patient population in Lincoln County and those who had chronic health issues. And this one specifically, last year we looked at diabetes, and then also had some food insecurities. And then from that, we brought those patients in. We did a basic mini health fair with them, I guess you could say, at the beginning, where we checked their cholesterol and their blood pressure and those basic health evaluations, and then did some training and teaching. Unfortunately, last year with COVID, we weren't able to have the larger education group classes that they have had in the past. We're hoping moving forward this year that we will be able to provide more of the education parts. We did notice some improvement. This is over a short period of time. We started in August of last year and we ended middle to end of November. And we noticed that there was an average body weight decrease of 4.15 pounds in this population. And this was without trying to diet and exercise. This was just with changing their eating habits a little bit by introducing some fresher produce into their diet. Their hemoglobin A1Cs, there was a small decrease, but again, there was a decrease of 0.68%. Total cholesterol decrease by 1.2 milligrams. We had 39% of our participants reported eating more fruit, 23% participants reported eating more vegetables. And then when we started the program, there were 33% of our individuals that couldn't afford to eat healthy meals. And then when towards the end of our program, there was only 3% of our participants who reported not able to afford healthy meals. And I think part of the program was to teach them what a healthy meal is. We all struggle with that, and educating and understanding what is available, because a lot of times, as we've all said, sometimes some of the more healthy or unhealthy foods are some of the cheaper foods, and so or easier to access. And so that becomes a problem, and we're very happy to be able to partner with this. Lincoln County does have a food pantry that it participates in. We have donated in the past to the food pantry at Lincoln Primary Care Center, Southern West Virginia Health Systems. We are not directly affiliated with that food pantry, but that is available to our communities. Let's see, make sure I've answered all of the questions that we have here. Now, and like I said, with COVID that has came, it not only has it created difficulty in getting healthy foods and accessing healthcare, we were fortunate that we were able to remain open and were able to transition our services into telehealth if the patients felt the need, or if our providers felt our patients were at high risk, we would recommend a telehealth visit. We were at probably our peak, we were seeing around 30% of our visits per week at telehealth. Our last count, we were down to 4 to 5% telehealth visits. We still have some patients that are feel fearful of getting out into the public and getting into that healthcare setting. With understanding, we have made the vaccine available. We've tried to educate our patients as well as safety and of what we're doing internally to protect them when they come in. We have also been able to utilize this time when the fast transition to telehealth happened with everybody. We've been able to build on that and develop some more telehealth with our local partners, local hospitals, to provide some specialty services to our patients who, due to transportation issues, were not able to get to these locations. Plus, for some of them, it is very difficult even to get into our office, much less get to the hospital. They have to pay for a ride, and it's just very difficult for them to access that care or to get reliable transportation. So COVID has been fortunate in that one thing is it's forced us to look outside and work outside of the box and how we provide the care to our patients. And that is all that I have today. I'll be happy to answer any questions.
Awesome, because we've got a lot for you. So presenters, could you turn all of your videos on, and we will get to the Q&A box and see what we have there for us. We have a couple of questions and comments. We'll start with the first one received from John. It is for Dr. Ellis. On a person-to-person basis, how do you gain buy-in from patients and programs participants regarding changing their eating habits? Folks can be pretty ingrained in attitudes about what is good.
Hey, John, thanks for the question. That is a very good question. And you make very good points there with ingrained opinions on what is good. And I think the biggest thing really is just results. So you have to be able to show people the benefit and the advantages that they will have from eating healthy, whether it's a A1C that's going to drop, or whether it's them being able to fit different clothes, or whether it's just them feeling healthier or having more energy. It's just that you're going to have to be able to show results and continue to encourage and to help them to understand that it's just a process and a lifestyle change, that it's not something that will happen overnight. So my biggest thing would be you get buy-in from the participants by results. Even if you can show them it in someone else, they're more likely to believe it for themselves too.
Great, thank you, Anitra. Let's move to a couple of comments. The first one is from Kevin, who was a presenter for session 1, who says, Mountaineer Food Bank sponsors a bi-weekly deliveries out of Rock Branch facility to Boone County for member pantries and partnering agencies for free. Please contact Kevin Hall for more information. So we will get that information to the folks with Mark, and appreciate that. Let's move to James Vance. He says, not so much as a question, but a comment about some things we are working on in Boone County. And I believe James is with DHHR. In partnership with Kathy Schrader, Boone County FRN, Active Southern West Virginia, and Mountaineer Food Bank, we are working with Barnes Community Center to increase capacity at their food pantry to be able to serve more people in Boone County. That is great. Thanks for sharing that, James. And at the end of this series, we're going to have a final brief, and we hope to put all of those resources into the brief so folks will be able to know what's going on currently within their county. So we appreciate that. We have John again, who has one more comment for Ms. Reynolds and Mr. Linville. I grew up in Pittsburgh near public housing. They have no stores and little transportation. One enterprising man had this ancient school bus. He said this was in the 60s, so really ancient now, that he turned into a rolling store. Could the same concept be used to get healthy food and healthcare to the people who can't get access? Food, well child checks, blood testing, wound care, just thinking outside the box. What are your thoughts?
Actually, I think any access to food would be greatly appreciated. That seems like a very, very good concept. And if we had something like that, because we do have, I know that one of our local FQHC has a mobile medical office that they do take around in some of the rural areas. So if there was a truck or a bus or something that could go to the rural areas in not only Boone, but Lincoln and Logan counties, I think it's a great concept. And maybe it's something that could be supported through some grant funding.
And just to follow up with what Mark said, yes, there is a local, another FQHC that does have a mobile unit. I think it focuses a lot on the school-based health in Boone County. We also, we have, I think that's a great idea. Because there are a lot of rural areas and just very hard to reach areas that our patients don't have the best access to. I know some of my patients have had difficulty getting home health because of the state of the roads to their home. Home health can't get there. And so that's one of the issues that our patients see. We are also in the process of looking at a mobile behavioral health unit that houses, we're partnering with some folks in the Huntington area that will allow this population to be more mobile, to get access and to expand that into these counties. We'll be starting with Lincoln County when we kick off. We don't have a date for that yet, but that is something that is on the horizon for us.
That's great. Thank you. Dr. Ellis, do you have anything to add? Okay. We'll move on to Emma's question from the Primary Care Association. She says, for all the panelists, I never hear health educators or health programs discuss the use of frozen fruits and vegetables when fresh produce isn't readily available. Are you proponents of frozen fruits and vegetables for affordability and nutrition value?
I'll start with that. Yeah, obviously that is a definite option. I know I've had that discussion myself, and I'm sure Anitra has too with her patients. But we often find some of the discussion that I've had with my patients is cost. Yes, frozen vegetables do last a long time. Their access to the frozen vegetables, they can find canned vegetables on sale a lot more. So that's more of what my patient discussion that, we've had them to keep a diet log and bring it in, and then, discuss the options that they have of how to make healthier choices with looking at a meal that they've actually eaten. And that's been historic, what I've seen when I've discussed some of that. A lot of it comes down to cost and storage. It's easier to store.
Thanks, Courtney. Anyone else have anything to add to that one?
I would say definitely, it's all about education though. And, patients may think that they're eating healthy when they're eating the canned, even though it may have more stuff in it that we don't want. So it's all about being able to teach them how to read a label and to see what's in it. And, to kind of look and show them, this is why we would prefer this over this. Of course, we want fresh first, but I would definitely say frozen fruits and vegetables are something that we could probably, push more as far as educating our patients on their nutritional value.
Thank you. And John added, there are people in the community I tutor that have generators as their only energy source. And we heard that last year when we kicked off the Health and Hunger Summit series. So it would be interesting to know how many people have to rely on generators, and if keeping frozen food is would be a real challenge for them. So thank you for that, John. We have another question from Judith. Well, I think it's a comment. You might reach out to Governor Justice for CARES dollars to support a mobile unit in the counties that may need this as a resource for services. Since listening to him 3 times a week, I understand that there is extra care dollars, but still available. Worth a shot, right? So we'll look into it and see if that's something, and we'll discuss it at our next session, see what we found out. So thank you very much for all the comments. We're going to go to some pre-planned questions, but if anybody in the audience has any other questions or comments or something that come up while we're answering these, please feel free to put them in the Q&A box. So let's go to question number 1. And some of you may have already touched on these. Let's just reiterate so we can make sure it gets into the notes and into the brief at the end of the series. All of you in your respective roles within the healthcare system work to address food insecurity and poor nutrition. When it comes to hunger and diet, what is the biggest challenge your communities face to improving access to healthy food?
Well, I'll address that, and I'm sure that Dr. Ellis and Courtney address these as well. A lot of times just access, it's transportation, it's availability, it's the hours of operation with some of your food pantries and food banks. And if you don't have, even if you're supplying the food and you have it readily available, if you don't have the transportation to go and get it, it's a hindrance to be able to receive healthy food. And I think Courtney addressed it, is a lot of times we substitute unhealthy food, which is cheaper food, for healthy food. And this obviously leads to other health issues.
And I think, to add on that, the poor nutrition is not only access, because a lot of people do still have gardens. That is something that, and we've actually seen a little bit more over the last year, really, people trying to raise a garden themselves. But the way that you prepare food is a big difference too. If you prepare your green beans with bacon fat and a lot of salt, it's not going to be as healthy. And so just because you're eating a vegetable doesn't mean that it's always the healthiest way it's prepared. So even access to the food, it's the education of how to properly cook it so that it is healthy and good.
That's a good point.
And also, I think I'll just go back to the education, as Courtney was saying, people think because they're eating vegetables, it's healthy no matter how it's prepared, but that's just the culture, I guess, that we have around food and obesity, that it is healthy, no matter how it's prepared. So I think it just goes back to, educating people, what you put in your body, it's going to affect your health. It's going to affect your heart. It's going to affect, your vision. It's going to affect everything when you have diabetes. It's not just going to affect your blood sugar. It has more consequences. So I would just say, going back to educating people, the importance of healthy food.
Right. Thank you all. Let's move on to question 2. It's easy to say healthcare providers should screen for food insecurity and refer patients to community services if needed. What are some of the challenges to screening for food insecurity? Is there value to screening if there aren't services to refer patients to?
I'll start with that one. I think it's always important because it does affect how you care for your patients. Some of the challenges that I have seen in screening is honesty. A lot of times the screening are done by our nursing staff initially. That's the way that we do it. And then the comfort level you get of your patients disclosing what challenges they have. If it's a patient you've seen for a long time, you're more likely to get an honest answer. If it's not, sometimes they don't want to tell you that they have issues with transportation or they have issues with getting healthy food. And then, once you identify that, even if you don't necessarily have services to refer them to in the community, or reliable services or scheduled services, I think that it's still important to identify that issue, because you may be able to still help them to make healthier choices with what they do have available.
Thank you.
I think definitely I would say, a challenge is just honesty for the patients because um, when you need help, it's not always viewed um, correctly. And, this is not just people who don't work. We have people who work 40 hours a week who still can't afford to buy food, let alone buy healthy food. So I think it all comes with establishing the relationship with those patients so that you can get the honesty, like Courtney said. And then there are a lot of resources available. Sometimes we have to think outside the box and, maybe refer them to a local church or something like that. But there are plenty of resources available. And a lot of times I think if we were to, combine everybody instead of reinventing the wheel, we could do a lot better because everyone using their sources together. But I think definitely it's something that we have to screen for because, the way we eat, it can improve our health or it can be harmful to our health. So we definitely have to screen for that.
Thank you for that. We discussed it last year, and I think it'll come up during the next session, the problem of stigma and, and kind of West Virginia pride, as we called it, because people don't want to admit that they're, struggling to make ends meet. Maybe COVID has helped people bridge that gap, but it'll be interesting for our conversation next week. Before we get to question 3, I'm going to share John's comment and hear what you think of this. Could the assorted West Virginia healthcare organizations band together and advocate for removing things like Monster and Mountain Dew from eligibility under SNAP with our congresspersons? Soda is cheaper than milk. What are your thoughts on that?
I think that there's been conversations going on for years of unhealthy drinks and sugary drinks. That's one thing I alluded to in my comments, that those who do not have access to healthy drinking water is, instead of buying bottled water, they'll buy soda. And we can address this. I agree with Dr. Ellis. I think the only way you're ever going to change that habit is through education and lifestyle change. You can eliminate it, but they will find it. They will get access to it if that's what they want. I really don't have an opinion from removing it from the SNAP program, but they'll just use other resources to gain access, in my opinion. Now, again, back to Dr. Ellis and education. I think that's our key.
And I will say, John, I can't remember how many years ago, but it was Boone's own Senator Stallings who tried to get a group of legislators together and wrote a letter to the federal government to see if some things could be removed from SNAP, and it did not. It was not successful. So people have thought of it. It wasn't successful to date. So with that, let's move to question 3. How has the pandemic affected your organization with fewer people accessing healthcare and more staff dedicated to distributing vaccines? Is this a time when healthcare organizations can focus on food insecurity?
I would say that this definitely, has to be a time because with the pandemic and with, people being out of work more, we're going to have higher issues with food insecurities, maybe from, the middle class family who we wouldn't typically see it from. So I would definitely say that we need to definitely focus on this. And, vaccines are very important in our, at Coalfield Health Center, we do participate in the regional vaccine clinics. And, we've been very fortunate where we've been able to get volunteers so that we don't have to pull a lot of our staff away. But I would say, with the more food insecurities we're going to see at this time, we definitely need to focus on being able to recognize that in our patient population.
Thank you.
I'll kind of echo what Dr. Ellis had said, and that was that, you know, we have participated in actually all of us three panelists have all worked together in different capacities to partner for the vaccine events in our communities, and it's been great for the communities. It's been great for our partnerships, and hoping that can continue those partnerships and other aspects in the future. We have been fortunate at Southern West Virginia Health System and Lincoln Primary Care that we have had most of our administrative staff actually have been the ones participating in the vaccine clinics, so that our day-to-day clinical staff have been able to continue to focus on the patients and the patient's needs. And so that's something that we also have utilized our school-based health center while the schools were closed to be able to do a little bit of both. And that's one of we're very fortunate in that way. But again, you know, you don't have the ability to not address it. You know, it's part of our patient's health. It affects their day-to-day health. And so I think that you can't lose sight of that regardless of what's going on.
Yeah, I'll echo Courtney's comments. I've been very involved in the vaccine clinics, and actually have spent the majority of my time recently. In fact, I think Courtney and I had a 10:30 meeting this morning that I think we missed, but hopefully someone from our organization picked up on that. But you are correct. We are dedicating the majority of our time to vaccines right now, which we think is important. We do need to continue to focus on food insecurities. I'm not a provider, so I will leave most of those comments to Courtney and Dr. Ellis, but unfortunately we are spending a great deal of our resources and time toward the pandemic.
Thank you for that. Let me share Robin's comments in the Q&A box. It has been found that sugar triggers release of the feel-good chemical dopamine in the brain. Eating a lot of sugar results in high levels of dopamine in the brain. This might be one reason why we crave sweet foods when stressed or after a shock. Thus, food choices are often directed towards sweet food whenever we're filled with negative thoughts and feelings. Do your health programs teach other healthy options when feeling bad mentally or physically?
You know, that's one of the things that we look at when we look at the social determinants of health on our patients is their stress level. And in looking at that and looking at the answers that our patients have given, they answer that as one of the top concerns is stress. And it could revolve around work, it could revolve around family, it could revolve around you know, finances. There could be a million different reasons why. And trying to change that instead of that, you know, the stress eating that we see often in making those healthier choices. Exercise is a good way to relieve stress and to help calm you down, and teaching people that you don't have to be able to run a marathon. It's getting up and moving. It may be just walking around your house a few times. But not only does that help with getting you active, but it also helps to kind of take you away from maybe that stressful situation and get your mind clear. But the emotional and physical aspects to try to train and teach patients that there are other options than that stress eating.
Thank you. And thank you, Robin, for that comment. Let's move on to question 4. What can we, the general public, help you do what you do to improve the health of your communities?
Well, I think one thing that the general public can do is like I mentioned, you can volunteer. There's a lot of food pantries. There's a lot of food distributions. A lot of our churches, a lot of our 501c3 organizations are distributing food. And so I think one of the important things is to volunteer. And once you volunteer, then you get an idea of where the food insecurities might be, not only in a region, but geographically and locally within your communities. And by addressing those food insecurities, you might have the ability to distribute food in those areas that are the least served.
That's a great point. Do any of you three know of like a countywide bulletin board of volunteer opportunities? Is that something that's available? Maybe that's something.
Not that I know of.
Maybe that's something we'll focus on at the end of the series. Courtney, what can we do for you in Lincoln County?
I think, like Mark said, it's volunteering, and maybe not even, if you can't volunteer your time, volunteer your voice, and help to share what is available in the communities. Because again, people may reach out to their family and friends before they're going to reach out to their healthcare provider or someone else in their community. And a lot of times we see there are a lot of people who are willing to give and to donate and to have these services brought to the areas, but they don't know where they need to be. And so again, if you can't volunteer your time, volunteer your voice and help to educate and then help to share the needs of the community.
It's a great point. Thank you, Courtney. Dr. Ellis, is there anything you want to add to that?
No, volunteering is definitely good, and just coming to the table, bringing any ideas or suggestions that you may have, so that we can get those into use, but volunteering for sure.
Great. And I'm so glad that you all brought that up, because it came up months ago when we were having another series, and we discussed the fact that sometimes there'll be a program or a project, or somebody just got grant funding to do something in a community and nobody knows about it. So it goes underutilized. People don't, dedicate their time or resources. They don't get the word out. And then what you find are meaningful community responses that just nobody knows about at the time. So trying to find a way to make sure we're not reinventing the wheel, and that we're pointing people in the right direction when that program is going on in a community. So that was very helpful. I want to share another remark from John. The agribusiness knows darn well that the corn syrup they use as a sweetener is not recognized by the brain as a sugar, so we don't feel full. So we are not only attracted to the sweet taste, but we no longer have a natural mechanism to shut it off. Thank you for that. And I do think that sweetener in a lot of our food has contributed to our growing obesity problem everywhere in the country, but also particularly our high prevalence rates in West Virginia. So let's go to the last question, which is panelists. We have 2 more sessions of the Health and Hunger Summit. What can and should we discuss, particularly with those who collaborate to provide both healthcare and resources in your communities, about improving the health of those living in Boone, Lincoln, and Logan counties? So what would you like to see discussed or delved into a little more?
I'll go first, because, our other 2 panelists are actually healthcare providers and probably have a more in-depth knowledge of this. But, I think one thing we need to address, and I mentioned a little bit of mine, and obviously I know there's several, Mountaineer Food Bank and some other people come in and contribute. We need an overall sustainability program. We need, like I said, some type of agency that's sustainable. We get a lot of the churches that come in and they will have a food drive. We have like our VFW that'll have a food drive, but they do it limited times per year. We have our food pantry at our church, which is like open 3 days a week. What we need, I think, is discussion about a larger 501c3 organization that has a sustainable, and maybe some of the comments might come in from some of the food banks. Maybe it's there and I am just unaware of it, but we need something that is a continuous, sustainable organization that we can depend on year round, and not just in pockets of time when there's a pandemic or a holiday or something like that.
Great, thank you for that. And we heard that a lot during last year's sessions as well. There needs to be some sort of sustainable structure. Courtney, Dr. Ellis?
I think you pretty well covered it there. It can get overwhelming, for these smaller organizations to, kind of uphold consistently, what they do as far as providing food and things like that. So I said, don't have to reinvent the wheel, but if everyone would kind of come together and bring our resources together, I think it would be, easier to sustain and be able to, reach a greater portion of the community that needs it.
Great, thank you. We did receive another remark in the chat from Carla. Potential to work with WVU School of Public Health. Adam Baus and team developed a platform called West Virginia Connect to do exactly what you are asking for. And we used it to communicate about diabetes self-management classes in the state. I wonder if there is opportunity to use it for this purpose too. Are any of you familiar with West Virginia Connect? No. Well, it seems like that's step one, right? To get it out there and see what it is and see if people can potentially utilize it to help do this. And I'm assuming that it's perhaps does some asset mapping and finds where there are resources and then trying to start from there and then getting a better connection between providers. And this is something that we've talked about, not just last year during the Health and Hunger Summit, but for years, that it's a little odd that, food insecurity is one of our largest problems, and yet there's really no infrastructure. It's really very much a ground up approach. So communities respond, and we like that communities respond to their needs, but sometimes you need that larger infrastructure, particularly when you're talking about overwhelming need that can't be met just on that community level. And so with that, I believe that we are, and one more comment from Emma, West Virginia 211 is building out Aunt Bertha to more readily find resources by zip code. And we did learn that last year. Do any of you work with the Aunt Bertha program?
No, not currently.
Okay, so that is something that we discussed last time around with the United Way, and I think that there's, as you may know, the United Way took over West Virginia 211. I believe it's been a year and a half now, and one of the things that they did, because one of the problems that we have without that infrastructure that we discussed previously is that, many of our pantries are run by volunteers, and so they may change hours, they may temporarily close, they may not be taking on new clients. And so it's really hard to just pick up a phone and try and find where food is available. And it's very hard for providers to refer people to pantries if they're not sure when they're open or who the contact person is or how to best contact them. So the United Way has really been working to beef up and update West Virginia 211. And what Aunt Bertha is working to do and piloting is, when a patient leaves the hospital, for example, they get a list of where those resources are in the community so they can contact them. So that's a wonderful way to try and bridge one from the other. And I'm really excited to see how that works out in the upcoming months. And with that, I will ask both panelists and attendees, do you have any more questions or comments you'd like to share before we wrap up today? Well, James, thank you, James Vance. He shared the link to the West Virginia Health Connection, and we will put that on both our social media sites and on our YouTube channel, where this video will be tomorrow morning. With that, I'd like to really thank our panelists for the time and attention that you and the meaningful discussion that you have created today. And I'd really like to thank everyone who shared their questions and insights today. And with that, hope to see you next Tuesday, everyone, and have a great day.
Thank you.
Thank you.